Hello, I'm Pauline Ford, and I'm talking to you today from the University of Queensland School of Dentistry in Brisbane, Queensland, Australia. I've been the head of the School of Dentistry for 5 years, including last year, and I've recently moved to an Associate Dean role. Thanks so much for the opportunity to contribute to your symposium by sharing some of our reflections on our journey through 2020. So here at the School of Dentistry, we're located on a hospital campus. We moved to a beautiful new building in 2015. We've got a fairly large dental service facility which accommodates our students' clinical placements. We're a fairly small school. We have 55 staff, cohort of around 400 Bachelor of Dental Science honours students, 30 Doctor of Clinical Dentistry or Specialty Training Program students, and 30 PhD or MPhil students. Current status of COVID-19 here in Australia is that we're now producing our vaccine locally, the AstraZeneca version, and the vaccination rollout has commenced with the first priority populations receiving vaccinations. Our international borders remain shut, and there is little political will to change that in the near future. We're very fortunate that currently our restrictions are quite minimal. Currently, there are 149 COVID cases, all of which were acquired overseas. Over the course of the pandemic, there have been around 30,000 cases and a death toll of 909. That's in the context of a total population of 25.7 million people. We have had 2 waves here in Australia, the first in March, April, and then the second larger one, July, August, which was focused primarily on the state of Victoria. In Australia, the Australian Health Protection Principal Committee is the key decision-making committee for health emergencies in Australia. It's comprised of all state and territory chief health officers and is chaired by the Australian Chief Medical Officer. Commencing on the 29th of January, the AHPPC provided regular COVID-19 guidance to our political leaders, health services, universities, businesses, and the general public. And that's resulted in a generally cohesive and effective national response. The Australian Dental Association developed additional infection control precautions to manage risks in dental practice, as well as manage practices for patients at risk of COVID-19 and for those diagnosed with COVID-19 and who needed urgent care. These guidelines, outlining 5 levels of restrictions, were endorsed by the AHPPC. The AHPPC recognised that if access to dental care ceased entirely, this would place a burden on medical primary care and emergency services at a time where that just couldn't be afforded. Level 3 restrictions were applied from the 27th of March, and that meant that no treatment could be provided that produced aerosols. This went to level 2 from the 26th of April, a small increase in the range of treatments that were allowed, still minimising aerosols. During this time, there was a tension between maintaining clinical placements and of rising anxiety of the health services and of students. An added complexity was the shortage of PPE supplies and the uncertainty regarding the type of PPE necessary. From the 7th of May 2020, Australia has been operating at level 1 restrictions, which means that we've basically been able to provide all types of dental care except for non-urgent care for suspected or confirmed COVID-19 cases. So what does all that mean for the School of Dentistry here at UQ? So like all dental schools, it was a tricky year. We started the year by listening closely to any and all advice and information that was available, while simultaneously undergoing scenario planning. During the week of 16th of March, the University of Queensland decided to pause teaching for a week. And that was to provide the time, not much time, but some time for academic staff to rapidly convert all of their materials to online. Around about that time, our overseas students, particularly those from Singapore and Canada, were under pressure from their families and home governments to return home, and many of them did. Soon after, our clinical placements ceased, except for our rural clinics, and I will explain a little bit about that in a moment. Closely followed by a directive for all staff to work from home, except for those staff involved in continuing critical research activities. Our regulator, the Australian Dental Council, required fortnightly reporting during this rapidly changing period, and that was to ensure that the changes that we were making were in line with their expectations around what was required of students at the end of the program. Over time, as the first wave subsided, and in Queensland we were relatively protected from the second wave, we've moved back to resume clinical placements and on-campus activities. But we realise that we're much more fortunate than many others. So our rural dental clinics are operated by the School of Dentistry, and they are in two very small towns which are west of Brisbane. So they have small populations, not great access to services or dental care otherwise. And they service a community that has a large population of Aboriginal and Torres Strait Islanders. Now, this particular community is very susceptible to COVID-19 impacts, and so it was particularly important that we considered carefully our ongoing activities in those clinics. So we consulted very closely with the community and peak body, and the advice was to continue with our clinics because they were providing an important emergency service for the community and preventing them presenting to hospitals. There was no confirmed cases in that area, and so it was decided that with very high level of caution, so minimising face-to-face contact as much as possible, isolating staff and students arriving in the community, that we should indeed continue our services and placements. And we operated right through the pandemic with no break, and we're the only clinical placement site in Australia for dentistry that was able to do so, and we're very proud of that. So our students who were not involved in clinical placements were having a very challenging time adapting to online learning. So one of the initiatives that we undertook was to send them a care pack with some very simple materials that enabled students to get involved in a weekly competition. So you can see that some of our talented students here did some really great work in the drawing challenge, the sewing challenge, and the wax tooth carving challenge. My personal favourite, though, was the baking challenge. Where are we now? So at the end of last year, all of our students graduated as planned, and students in their final 2 years of study were approved to return to Australia if they were overseas. Of course, they have quite an altered plan of study to catch up on what they've missed. We still have around 50 students in earlier years who are at risk of progressing normally through the program if they're unable to return very soon. Student wellbeing through last year and into this year is a concern. Some of our students haven't been able to see their families and homes since early last year, and everyone's struggled with the isolation of online learning. I'm really very proud of our staff who have embraced blended learning and assessment approaches, engaging with new technologies, learning new ways of doing things, and reflecting on old practices. Our students have told us that they want the best of both worlds for future learning, face-to-face and on campus when it adds value, and online where it makes sense and gives flexibility. We've concluded that the lecture isn't dead, but we have certainly reimagined it. The University of Queensland has provided extensive support and including financial support to our students who have been at risk or in very challenging situations over the last year. And I think that's something that we really have to keep in mind, is the impact on student wellbeing. So today is the 26th of March 2021. At the beginning of my presentation, I indicated to you that we had minimal COVID-19 restrictions. However, in the last couple of hours, a new community transmission of unidentified origin has been detected. Now, we are currently awaiting what the outcome of that will be, but I guess that's the lesson of 2020 and 2021, is that we need to remain open to change. We're not through this yet. We've learned lessons. I think that will see us through the other side. And I'd just like to congratulate everyone who has managed to keep their head above water through a very challenging period. Thanks again for the opportunity to speak with you today. It's been a real privilege.